Thank you, Mr. Speaker. Our biggest mistakes in life are often the results of refusal to recognize and admit our mistakes. This government continues to jeopardize the lives of Albertans with its centrally controlled Health Super Board. They started out with a totalitarian gag order, forbidding our health care providers from speaking out. They threatened disciplinary action to any who dared speak out, then claimed to rescind the order a year later, but the reality and perception from our health care providers is the code of silence hangs over their heads. Over the past several weeks, it has become public and clear that emergency room care in Alberta is in crisis. Several highly respected emergency room doctors have graphically described our ER system on the brink of collapse. Leaked documents have detailed hundreds of ER horror stories. The Wildrose caucus has listened to and met with many health professionals across the province in order to formulate a series of proposals aimed at immediately addressing the ER crisis in a practical and time-sensitive manner. The Wildrose Alliance proposes the Government of Alberta implement the following measures. 1. Ensure a chief medical officer is assigned at all times in every hospital with an emergency room. The CMO should be given unilateral authority to make decisions concerning all units in the hospital. The CMO must be able to open beds in non-ER units, reassign staff, activate additional staff, and, if necessary, override AHS directives, regulations, and regular staffing ratios in order to alleviate ER blockages that are endangering lives. 2. Immediately activate the nurses needed to deal with ER crisis. 3. Immediately increase all necessary support staff. 4. Open up an additional acute care bed by moving healthy senior waiting in hospitals into temporary living accommodations, such as senior-friendly apartments and other lodging arrangements. And 5th, work to greatly accelerate the building of long-term care and assisted living facilities as well as home care. In closing, I want to thank those health care providers who have bravely spoken out, and for all frontline workers, without you, the crisis would be worse.